Hey there, thanks for joining me today. We are talking about a really critical topic in pregnancy, labor, and childbirth, and that is informed consent. So it is critical that our care providers provide informed consent so that we can make the best decisions for ourselves during pregnancy, labor, and childbirth. So in this video, we're going to talk about what is informed consent. I'm going to share a very easy to use strategy to help you put informed consent into your own hands and be ready with a very easy to use tool. And we're going to talk through 3 very common examples in labor and pregnancy where informed consent is critical for decision making and talk over how that looks. So grab your partner or show this video to them later, and we are going to get real clear on informed consent. Hey there, if we haven't met in real life, my name is Alice Turner. I am a birth doula, a Lamaze certified childbirth educator, and on my channel I talk about birth. So if that's a topic you're interested in, make sure to hit the subscribe button and the notification bell so you'll be notified next time a video is out. So informed consent is so important that I am actually going to read the definition to make sure I don't get it wrong. Informed consent involves voluntary permission given by a person or advocate for treatment or procedure after being informed of the purpose, method, and possible consequences, risks, and benefits. Okay. You will notice that I have pulled out some of the most important words found in the definition of informed consent. And I just want to run through each of these so you understand what they mean. So when your care provider suggests a treatment or a procedure, you should be told about the purpose. So what is the reason for this treatment? Why are they suggesting it? Is there a reason, a purpose, a reason? That is a key piece of information. The next one, the method. What does this procedure or treatment look like? They should tell you a little bit about it, and they should allow you to ask questions about it. The next one, possible consequences. So as a result, what are the results that we're looking for from this treatment or procedure? Hopefully the positive results, why they are doing it, and what will the results be. The next one is risks. Are there risks with the treatment or procedure that's recommended? And also, what is the likelihood of the risk? Is there a big risk or is the risk very small? And giving you that information is really important to put those two together. Finally, the benefits. What are the benefits of choosing this particular procedure or treatment? So all of these together, these pieces of information together, make up informed consent. So when you're working with your doctor, your midwife, your nurse, and they are suggesting some type of treatment, this is the conversation that should be given. Now, it seems maybe like a lot, and it's a lot to remember, I think, but we have a very easy to use tool that doulas and childbirth educators teach. I want to go through this easy tool so that you have the power of informed consent in your hands so you can help guide those conversations with your healthcare team. So this is a great tool for both the pregnant person and the support person to know about. The support person specifically because they are not going through labor. They can be in charge of something like this to make sure that the informed consent conversation goes well, whereas the person that is laboring might not be able to remember all the steps and all the information that they need in order to make their best decisions. So this tool is called the BRAINS decision-making tool. The reason it's called BRAINS is because each of the letters represent something that you can ask your care provider when a treatment or a procedure is suggested. Now, some of them you'll already have seen before when we talked about the definition of informed consent, and a few of them are new. Let's get into it. B is for benefits. So the benefits should be easily explained by your care provider. That one makes perfect sense, I'm sure. Number 2, the risks. Of course, we already talked about that. That's something that should be given, and the likelihood of each risk. A is something we haven't talked about, and that is alternatives. So is there another option? Do I have an alternative to what is being suggested? And very likely there are alternatives. Those alternatives probably have their own benefits and risks as well, but it's good to ask that question. I, in the BRAINS acronym, is your intuition, which is really your gut. What does your gut say about this? What were you thinking originally when you were planning your pregnancy, labor, and birth? And does this align with what you are feeling is right at this time? N is one of my favorites, and that is not now. You might also see it as never. So it's both ways, but if a care provider is suggesting a procedure or treatment, you could ask if it can be delayed, not now. This is often one of the most powerful first go-tos in labor and birth, to ask your doctor or your midwife, is this something that I have to decide right now? And if you don't, then you can have time to think it over, think about your questions, and think about the conversation that you might want to have more in depth with your provider. And the S, you don't always see this when you see the brain decision making tool described, but I like to add the S, and that is to smile. And what this means is just don't be a jerk when you're going through this whole thing. Be kind. Your healthcare team is on your side. They want the best outcome for you and your baby. And so if you ask these questions with a smile, with a positive, collaborative, shared decision-making kind of attitude, you will have a better response than if you come at them with a combative type attitude. And that's just common sense, but I like to add that as well, because sometimes it is hard for partners to not feel like they're having to be the protector and shield the providers from their loved ones. So smile. I don't know about you, but when I learn these kind of things, I want to see them in real life. Like, tell me when I will really use this. What does this really look like? And this is my favorite part. So what are 3 real life examples where informed consent is so important, and how do we make sure that we get informed consent? So the first one is actually something that a lot of people face and have to decide upon in pregnancy, usually the last few weeks of pregnancy, maybe week 38 or week 39, week 40, and that is a cervical check in the office during a prenatal appointment. Now, I have a lot more information about cervical checks that is in this video, so check that out, and I'll put the link below. So at your 38-week appointment, you might be shown into the exam room and asked by the nurse to get into a gown because your doctor is going to do a vaginal exam at this appointment. The doctor is going to check your cervix. Now, this is something that you should have informed consent about. You always have the power to not undress until you have all of your information and you've had a conversation with your provider. People don't always know that because it isn't really clearly stated as an option, but you do have the power in your own self to remove your clothes or not remove your clothes until you have a conversation. So I really recommend to people to wait and have a conversation about the cervical exam, or if at a earlier appointment your doctor lets you know that a cervical exam should be done, then that's a great time to talk about it then. Okay, so the cervical exam is suggested, and you have a great decision-making tool that you can use. You can ask your doctor, what are the benefits of the exam? What are the risks? Are there alternatives to having a cervical exam? How are you feeling about the cervical exam? Is it something you really want or you don't want? Is it something that has to be done now? And then talking to your provider in a kind voice. So going into this conversation with this brains strategy can help you get the information you need to get true informed consent and for you to make the best decision for your own healthcare. Okay, example number 2 happens in labor, and this is fairly common. That would be where your doctor or your midwife suggests artificial rupture of your membranes or breaking your water. So your doctor might say, oh, you're 4 centimeters dilated, let's go ahead and break your water and get things moving along. So this is not true informed consent, just that suggestion. So what really should happen is they should give you more about the method, the purpose, the risks. They should give all that information, but sometimes it is missed. So that's where you have the power of getting that informed consent with your questions. So first of all, if you don't remember the questions, say right then you just had a cervical exam, your doctor is sitting at your bedside, sitting down by your feet, looking up at you and saying, I want to break your water and get things going. So you might look at your partner and say, what are we supposed to ask? You might not remember. You can always ask for 5 minutes. Can I have just a few minutes to talk it over with my partner? That's a great time to regroup and to say, okay, what questions do we need to ask so that we feel comfortable with this decision? So that would be where you are going to pull out your notes and you're going to say, okay, we need to ask about benefits, risks, alternatives, intuition, not now, and say it with a smile, right? That is a real practical use of the brain's decision-making process. So some people find out all of that information and then say, that sounds good. And some people say, no, I think I'm going to delay it if I can. The third example is one to talk about when there might not be a lot of time for a long discussion and what informed consent looks like. And that would be, say, with an episiotomy. So an episiotomy is when a cut is done to the perineum to help speed up the birth of the baby. That is often a time-sensitive conversation, but it doesn't mean that it's a conversation that should be skipped. So your doctor might say something like, I'm going to make a little room for the baby. That is actually the way they are introducing the suggestion of an episiotomy. Really, it should be something like, your baby needs to be born quickly, so I'm suggesting an episiotomy. Now, that is a very quick time. You might have the ability to say, is there an alternative? And your doctor might say, we could try to push a couple more pushes, one more push and see what happens. Or your doctor might say, we don't have time. This needs to be done right now. And then the next time you push, they cut the episiotomy. So, but the thing about it is, informed consent needs to be given. They need to have that short conversation with you. Even if it's fast, even if it's a time-sensitive procedure, you should be informed about the treatment that they are recommended. And it should not be just washed over. Thanks for joining me on this important topic. I've put together that brains decision-making tool into a handout along with 7 other handouts that are handy for labor and birth. And I'll put a link below if you're interested in getting that information. There's also going to be a link down there to the free Birth A to Z course with 100 videos on different birth topics. So if you found this video useful, please give it a like, and I will see you guys next time. Bye.